Mark Scott from the Guam National Guard has been standing by very patiently waiting. Good morning, Mark.
Good morning, Mark.
Hey, good morning, Chris. Bree, how are you guys doing? Jason, all you friends at KUAM, good morning.
Good morning.
All right, I guess let's just start with, are you guys are still working at the quarantine facilities? Are you guys also doing the isolation facilities as well? Just give us a overview of how things have changed for you guys and what you guys are doing under this lockdown.
Yep, thanks, Bree. Still busy, still a lot going on. We did consolidate all of our QFAC operations to the Dusset Beach Resort, which is the former Outrigger. We have all of our personnel there, and we're right-sizing the force. But it is nice that we are there so we can consolidate all of our operations and logistics. I think it is important to say the role that we have there at the quarantine facility. Of course, it's in support of DPHSS, right? But we're assisting with baggage from the airport. We're assisting with accountability and deliveries to the rooms. So that's no change. Even though it's a new spot, we're still doing the same thing. Some other new stuff. Yes, you heard there's a new ISOFAC. We're not in the ISOFACs, but we do help with security outside the ISOFACs. It's staffed on the inside by the nurses, right?
ISOFAC, guys, that's ISO facility, isolation facility. It's where they put the COVID positives who cannot, the self-quarantine at home or self-isolate at home.
Yeah, thanks for that, Chris. We're a whole organization of acronyms here.
I know. I only know a few of them.
Yeah.
I mean, sometimes you listen to a sentence from these guard guys. It's like, yeah, the ISOFAC of the Indo-PACOM and the THAAD was the... like, what did you say?
It's like a whole nother language.
It is, yeah.
So thanks for keeping me in check with that.
Go ahead. Right on.
Right. Yeah, so that's some new stuff we have going on. We're also looking at some new upcoming missions, possibly, if they're pending approval. And that is sending some of our medics to support Guam Memorial Hospital.
Yeah, I was going to ask about that.
That's a request for assistance that we've received.
How many medics,
Mark? We're also looking at including some of our DoD partners in this effort as well, with an appointment memo from the Secretary of Defense. So hopefully we can bring our Naval Hospital and Anderson folks into this fight soon as well.
What's the timeline on that, Mark? And then what are the numbers? How many medics from the Guard are joining the fight? And then what are you anticipating from your DoD partners?
So the call went out. All the medics not already engaged with the JTF, we're going to come bring them in on orders, of course. Coming in on orders is a voluntary thing. And we're going to do some realigning of the force as well. So we're taking a look at that as we speak at this very moment. We call it troop to task, Chris. We look at the task on hand. We look more specifically at what the needs of GMH are. And then we meet that task with the right amount of troops. Yeah, so that the size of that force will be forthcoming once we narrow down all of the requirements that we have for that mission. And as far as bringing in our DoD partners, hopefully that request is also being drafted, and we expect to speak with the Secretary of Defense here within the next couple of days.
Right. Yeah.
Who makes that ask? Is it the National Guard, or is it what Lillian Posadas was talking about the other day?
The governor.
It's the governor. Okay.
The governor. Yeah, she'd take recommendations from our TAG, General Agigi, and if you guys remember when this thing first started, we had what's called a dual status commander, right? It was General Lazama, and a dual status means the status of Title 10, which is active duty, and the status of Title 32, which is the Guard and Reserve. So a dual status commander would be someone who can be in charge of both the active component, which is our Navy and Air Force brothers and sisters here, and our Guard and Reserve component. So activating the dual status commander again would help us bring these Title 10 forces into the fight. And that's what we're asking. That's what the governor will be asking.
Yeah, I'm not sure what that all means, but okay.
Yeah. Can you break that down any simpler, Mark?
Yeah, it looks like we're going to need help, so we're asking for it.
All right.
Thank you. There you go.
And so with
Did I go down that acronym road again?
Yeah.
When you talked about the Guard, possibly medics, right? Medics being deployed to assist the Guam Memorial Hospital. How many? Did you say how many you were talking about? Just a rough estimate?
No, I didn't. And we're looking at the numbers right now.
Oh,
it's going to depend on the mission requirements of GMH compared to what we have available. So it's like a right size thing that's still under the works right now.
But are we talking about like nurses, like critical care nurses?
We do have some trained nurses on our medic staff or medical staff, but they would be acting in the capacity of support. So it's important to know that this mission that we're doing is it's called a DISCA mission, Defense and Support of Civil Authorities, yet another acronym. And what we do, right, is we go into the agency, civil agency that needs support for as long as they need it. So we wouldn't be taking a lead role, no charge nurses, no supervisory type things. It's just to fill in the gaps while there are gaps to be filled.
Well, we know there are serious gaps in terms of the need for critical care nurses. That's just why I was asking.
That's right. And so in previous examples where we did have our combat medics in other places around the island, what they would do, not so much of the critical care or anything like, at the RN level, for example, but they would do basic things like triage or other entry-level type things that they're qualified to do in order to free up extra time for those critical care nurses.
Right, yeah.
So taking care of those like baseline tasks, even though they're not in those critical roles, it's a supporting role that enables the rest of the staff.
Right.
I see. Is this going to be similar to what the Guard did for like GRMC?
Again, Bree, it's going to be pending the specific requirements of what the ask is from GMH. But what we do know is that the request for assistance did come through, and they're going to iron out that detail. But yeah, basically, it would probably look similar.
Okay. Do you have anything?
Right on, Mark. And you know what I was wondering is, have you guys been part of any conversation to extend the lockdown? And if so, would you take on any type of enforcement role like we saw in the first hardcore lockdown with the road? What is it not
Blocks.
called again?
They're not roadblocks, but
They're
they're
not roadblocks.
road checkpoints?
Obstacles.
Education checkpoints, I think.
Education stop points.
Education stop points sounds good, Chris.
Right.
So like I said, the DISCA, again, the acronym Defense and Support of Civil Authorities. If the request for assistance came through from, say, GPD, for example, or if that was the order from the governor herself, which is whom we serve, then that is one of our mission sets that we can potentially perform. Yes, we hope it doesn't come to that, of course.
Right.
We are the neighbors, we are the family members, we are part of the community, and we would never, we would never hope that it would come to something like that.
Sure.
But it is something that we're trained for and prepared for. Yes.
Mark, I guess, go ahead.
I was just going to ask if you had any information about the assessment that was conducted at the SIF. And are you guys going to be doing any other additional work? The SIF, the COVID ISO facility up at SNU.
Are you guys fixing the aircon up there or something? Or is that what Lillian said?
She said that they conducted an assessment.
Right.
And I'm not sure if they're going to help install or what it is with the.
Do you guys have like an aircon unit that fixes aircons?
Yeah, so from my understanding, the constraint on that is that it's going to need a certified engineer assessment. So we're talking about constraints that are above our level at this point.
Right.
We've gone as far as we can with it. And like I said, my understanding is that it requires a validation or a certification from an engineer at the level above what we can provide this time. But we brought it as far as we can take it for now, pending a couple of those constraints.
Okay, Mark. And then lastly, I wanted to ask, was there any update with COVID-19 positives in the Guard that you can tell us about? Because I know you only talk about certain elements of the Guard and their duty status if they have COVID-19.
Yeah.
So has there been an increase, or what can you tell us?
Yeah, and it's not about, Chris, what I can say and what I can't say. It's really what do I know and what do I don't know. What I do know is that our joint task force still has only the one. There's been no additional positives after that one from a couple weeks ago. And that service member is expected to come back to duty here next week. We do have visibility on about 12 positives in our civilian population, which is the population of our service members who are not on the joint task force, right? Like we said in our last conversation,
Right.
These are the folks that are, waiting for a drill in September. These are the people that are not on orders. Do we want better visibility of that? Yes, of course we do. But at the same time, they have their medical rights to privacy. So we are asking, hey, If the soldiers are out there, and if you've gone and gotten tested, of course now it's targeted testing, but we would like our service members to report those things out for accountability, should they choose to do so. But again, Chris, they do have their HIPAA rights, and we're not in a position to ask them to violate that if they don't want to. So we're tracking about 12 to 13 overall. These are the numbers as of yesterday. But like I said, it's not, if I can say it, it's if it's the correct information, and there might be more, right?
Yeah.
There might be more than what we got yesterday. So that's the constraint that we're looking at right now.
Well, it's tight knit family, man. Our thoughts and prayers.
I just wanted to follow up on. I know we talked about this weeks ago, but I just wanted to. I can't remember what you said in terms of why the National Guard isn't conducting testing on its own, because you guys are still listed on the reports that come out of the Joint Information Center as you guys have a lab and you conducted 17, and then nothing else after that.
That's right, Bree. I see that too. And then it says 0, 0, and then 17. Right. So that was from one day back in March when all of this first started. And like I was saying a few minutes ago, the whole DISCA, defense and support of civil authorities, means that we're there to cover gaps with our capabilities when it's needed. And then as soon as it can be handed back over to that civil authority, that's when we take our step back and we remove ourselves from the equation. So for that one day, we tested a handful of folks. And then the very next day, the plans were like, okay, there's diagnostic laboratory services coming on board. Public health capabilities are coming on board. So we took that step back like we're supposed to and allowed the civil authorities to perform that capability on their own. That's the answer for that, Bree.
I see. But if they were to make the ask, the National Guard would be ready to go.
Yeah, so there's a methodical process for all these requests for assistance. It's not as easy as just saying yes to all of them, right? We have to look at legal aspects. It has to go through all of the gates, right? And we're looking at, is it a feasible mission assignment that we can perform while protecting the force and complying with laws, keeping everyone safe to include the community? So yes, are we ready? Of course we're ready, but that comes with the conditions of, is it feasible? So there's the balance that we have to walk, right? To do our duty, to be frontliners, but also, to do it in a way that's safe and to do it in a way that is compliant, right, with our doctrine.
It just is kind of just really mind-boggling that we have a backlog of tests and yet we can't tap into the National Guard if you guys have a lab.
And Heidi commented here, people are having to wait 5 to 7 days for test results, and the National Guard has a lab that isn't being used?
Yeah, I would hesitate to assume that the National Guard lab is even the right kind of test. I would hesitate to say that it provides the kinds of results. I would hesitate to say that we should be, a reporting source, a testing source, because we don't make that decision, Chris. We're not the ones that would take the lead and say we're going to conduct the testing. Right. Again, we're in support. We're in support of the policies of public health and the governor when it comes to this testing. So if that ask comes, if there's a way for us to, be more involved with the testing, even though we are already performing swabbing, then that would have to be a request for assistance that comes through the correct procedure.
Well, keep us posted, because we had all the doctors on and they were saying, hey, we're going to, enlist the private clinics. We're going to do this. We're going to do that. And I'm just wondering why they didn't ask the Guard again. So let us know if they do.
Will do, Chris.
Okay.
Yep.
Thanks,
Thank you very
Mark.
much.
Thanks, Mark.
Yep.
Appreciate it.
Anything else you wanted to say?
Yeah, next week is ESGR week, which is our employer support of the Guard and Reserve. And ESGR is yet another acronym that it all comes down to saying, who do we thank? Yes, we thank our service members, soldiers and airmen. We thank the families for their sacrifice. And, we also have to thank the employers out there, especially during a time like this. We're all making sacrifices. And we know that the private sector is getting hit as well. So the ESGR week is just a way to recognize the sacrifices of our employers that mean so much to us. Wouldn't be able to do it without you all. So if you need to learn more about the ESGR, please go ahead and look them up. The ESGR is a DoD program that was intended to support cooperation with the Guard and Reserve and the employers. And being that it is ESGR next week, I'd like to say thank you to all of our employers out there for your sacrifices and for supporting your soldiers and airmen.
Right, and this is usually a really big deal with
Yeah.
the ballroom and you know, crazy gatherings and all that
Yeah.
kind of stuff. So it's gonna hit different, like the kids say.
Just like everything else this year. bro.
Right, it's the year of hitting different, to put it lightly. Thanks, Mark.
You're up there.
Thanks, Mark.
Hey, thanks to Chris. Thanks,
Okay.
Bree, and thanks for being frontliners yourself.
Oh.
Thanks,
care.
Mark. Wash your hands, man. 7:19. We'll take a short break. Here's who's coming up on the show. We have the Republican Party chair, the Democratic Party chair. We've got Crystal Placos and Augustine Adeloop going to check in and give us an idea of what to expect